Sorry. All right. I will call the Committee of the Whole of the Mental Health Board meeting to order. Roll call.
Christina Brew. Adam Carson.
Here.
Linda Hope.
Here.
Leanna Cow. Here. Thomas Langhenry.
Here.
Amy Rapp. Here. John Reiner.
Here.
Carolyn Schofield.
Here.
James Swarthout.
All right, so we have a quorum. Is there any public comment? No comments? Okay. I will then close the public comment and go on to reports and presentations. So 3A, bylaws and policies. Was there a report on it?
No, we have nothing under bylaws.
Am I reading the right agenda? You have nothing? You have
Nothing under bylaws and nothing under building and grounds.
Okay, cool. How about ethics and compliance?
Yep.
3C1, FY26 Q1 outcome summary reports. Who is gonna, is that Amy?
Yes.
All right, cool.
I'll start. Yes.
Oh. There we go.
All right, thank you. All right, so ethics and compliance, this is a summary of Q1. I will not go through all of the reports, but there are several highlights that we wanted to call out. During the first quarter, there were 9 providers audited, including 2 brand new providers, which were Grief Guide and Rock in the Spectrum. So thank you to reaching out and being good partners to some of the new providers that we've brought on board. In the report, 1 report is still pending, so you'll be able to see 8 of them, but there were 9 total that were audited. There were some recommendations based on the audits, but no recoupment of funds is needed. Some highlights from the outcomes reports. So first I'll start with items that are either within or positively exceeding targets. There's a few that I wanted to call out. The crisis services provided, client crisis services provided, we were under what the goal was, so positively exceeding. And consumer experience surveys received, we had a great response rate. The goal was 93%, and we received 94%. So I have done a lot of work in surveys. I know it's hard to reach solid response rates, so kudos there. Under opioid settlement funds, which is 3 programs at 3 agencies, we were, again, either within or exceeding targets in the domains of increased knowledge and resiliency, abstinence and reduction in use, and there was no wait list in the first quarter under the opioid settlement funds specifically. So that is fantastic. Also under opioid settlement, domain 8, which is access and capacity. If you the metrics for the first quarter follow the trends of previous fiscal years, where Q1 is always the lowest number of participants. Historically, total number of individuals and new individuals receiving these services are low in the spring, and then will pick up throughout the year. Under the Access Grant, again, we're still on the positives. There are 11 programs at 7 agencies. We were either within or exceeding goals for the no-show rate, increasing or maintaining level of functioning, and hospitalizations. For fee-for-service purchase of position and grant, which is our largest, there's 55 programs at 26 agencies. We were above with maintaining knowledge and resiliency, maintaining housing stability, which is fantastic. We were quite a bit above what the goal was there. And then finally, under fee-for-service and purchase of position grants, under social connectedness. So I put this in the positives, even though the actual is below target, but I had a pre-meeting with the staff and wanted to point out that if you're comparing previous fiscal years for this metric, there appears to be a very large jump. Again, we're still not at the goal, but there is a large jump in increased social connectedness and a slight drop in maintaining. The pool of clients that is being measured for this domain has increased significantly with the new fiscal year. So this might be shaking out to be a more accurate picture. So that's something that we're going to keep our eye on. That was the positives. I've got a few areas where we were below that I wanted to highlight, and then I'll wrap up with some additional comments as well. So the following areas are places where outcomes were either below or not meeting targets. Starting with there was nothing under opioids, so I don't have anything I'm going to point out there. Access grant, prescriber capacity and utilization were both quite a bit below what the goal is, which is unfortunate. And then wait time, all three of these are likely related to each other. The wait time, the goal is 16 days, which is still over 2 weeks, and we're at 3 full weeks. We're at 21 days. So that is, again, something else we're going to keep our eye on. Fee-for-service purchase of position and grant, again, this is below, or not where we want to be. Abstinence and reduction in use. Also, under Domain 3, the increased level of functioning. Here we wanted to point out that the percentage of participants that have increased in functioning remains below target. This number has actually been consistently below target for the past few years, and this is, again, under an increased level of functioning. This domain is typical for organizations that are providing mental health services, so there is an expectation that people would be increasing their functioning, since the most common diagnoses such as anxiety and depression typically will improve over time. So can't conclude just based on this data exactly why this is the way it is, but this is something that we feel should get called out because the measurement is not reflecting what we would like to see. So the compliance team will be beginning conversations with reporting agencies in order to further tease this out. Is it measurement? Is it who's being measured? Is it truly that there isn't an increased level? So we're going to continue teasing that out. I promise I'm almost done. Some additional information to highlight. In the report from the health department, naloxone dose distribution has greatly increased over the previous fiscal year, and it's also a bit up over 24. In part, this could be due to some new initiatives such as the vending machine program to make doses more accessible. Suicide deaths appear to be down, but the total number does not include pending cases. Right now, they appear to be quite down. So again, that's not final, but hopefully that is trending in a positive direction. Mental health board trainings, so looking at the trainings that are that the Mental Health Board delivers. Right now, the numbers to date are between the past 2 fiscal years, so between 24 and 25. But I do want to call out, I discussed it with the staff, and they wanted to make sure that that it was mentioned that they're working on making a wise use of resources and dollars where they're not necessarily holding trainings if it has a very, very small enrollment, like just 1 or 2 people, in order to make sure that they're rolling those into larger training sessions in order to make the best use of everyone's time. I promise I'm almost done. There's a lot to report on. So the number is a bit lower, and it might continue in that direction, but it's not necessarily that fewer people are being trained. It's that they're examining the way trainings are being delivered. Finally, another item I wanted to call out in fee-for-service purchase of position and grants under Domain 8, which is capacity. The total number of individuals is served is down from last fiscal year and the year before, but the total number of new individuals, so total is down, but new individuals is up from the previous fiscal year, and actually Q1 is higher than each quarter of the last fiscal year. So there's a big jump in new individuals. So the way that this could be interpreted is that more people are seeking treatment than in the past. There could be a number of reasons for that, with things such as the county government making a declaration or recognition of it being Mental Health Month. Anything that can be done to erase stigma could be a positive sign. Could be that more people are choosing to seek treatment because it's less stigmatized. Again, we can't positively conclude that, but I think we would all agree that more people seeking mental health treatment is positive. Possibly, or maybe because there are so many more people, unfortunately, the wait list is quite long. There are 124 people on the wait list at the time of the measurement, with the average length of time being over 107 days. That's well over 3 months. Don't really consider that acceptable, but that is what the data is right now. So I know that was a lot to highlight, but we have a lot of outcomes reports, so I wanted to try to pick out some things that stood out. Any questions?
That's great. First, can we add Board Member Swarthout to the roll, please? Any questions? Thank you, Amy. That was very detailed, and I appreciate it. I like long. I mean, long is informational, so I appreciate that. That was a lot of good information. I think we'll take some of that information, too, in our discussion later, so I appreciate that. Linda?
I wanted to thank you also. These are more working meetings, so I think long is also good. Like, this is taking the place of what used to be a committee meeting, so I think that that's really constructive. I also am concerned about the wait times, and if you, if you decide to form like a smaller group that's going to look at some of the issues, the education I thought was interesting, and I wonder if maybe we've saturated the desire for, like, the QPR has gone down a lot. And I thought maybe there's not more people who are needing it at this time. And so if, that's another opportunity, if we're giving less education in one area, to maybe offer a support group or something else in another area.
No,
It's just
that's
something
a
to look
great
at.
call out. Absolutely, no, that's a great call out.
But I would be willing to help as you look at some, remedies for some of this, because the wait times just seem long, especially because in some places numbers are down.
Right.
So why are people waiting? And is it a staff issue? And I don't know.
Right. I think there is definitely more discussion to be had, but it is disheartening to see, both with more people seeking resources, that is negatively impacting the wait list. So, yep. All right.
Any other questions? Jimmy?
Did I do that right? Okay. I'm sorry I'm late, but we had just 2 overdoses in the county. I just came from the hospital, and one is on life support right now, and there's some dirty drugs out there.
Yeah.
So that's the reason why I was late. It was although it was an hour drive from Alexian Brothers in the traffic right now. So I just want you to be aware, your work is exceptional. Our work is exceptional. Certainly wait times, talking to our psychiatrists at the hospital, or even I know at Rosecrans, that wait time is there. I know that. To be able to get qualified staff is sometimes difficult. Some of our kids, our staff now are, and I don't mean to be, I'm an old guy. I've been doing it for 40 years, but they're green. And some of those young kids, as wonderful as they are, they're curious, but yet again, the need is still out there. I'm just telling you, I just left the ICU, and the need's out there. So I'm sorry I'm late, but I'm the call chaplain for overdose work, and as well as harvesting. We may end up doing that tonight. So,
It's a really good reminder of the people behind the numbers.
pardon me?
It's a really good reminder of the people behind the numbers.
Yes, there are. Yeah, I see it all. Yeah. Thank you.
Thank you for your comments. Okay. Linda?
And I had a question that I forgot to add. So are we going to, do you have a plan, Amy? Are we going to address some of those issues, or just watch them, or what is the plan going forward? Because those numbers are concerning.
That's a great question. So we just had our meeting yesterday to start talking about what we wanted to look at and to agree on it. So we don't have a specific plan right now, other than the items that we called out specifically as ones that we want to watch. But we can have more information, probably not by tomorrow's meeting, but happy to provide more information on that. Amanda, I don't know if there's anything you would like to add there. Oh.
Yeah, so the first thing that we're going to be looking at is that increased functioning. I think that's domain 3 in the FFS and POP, because it has been consistently low for a couple of fiscal years, and I look back at all the quarters to confirm that. And it may be an issue of the question, it may be an issue of how we're measuring it, it may be an issue of honest, not increased stability or not increased functioning. So the first conversation, the first piece of that is having a conversation with the providers that are reporting that, so that we can sort of suss that out. Secondly, and I just wanted to address the wait times, because they are high, but our wait time number is very skewed by the developmental day programs that we have. And those are really constricted by state resources. So somebody who is waiting to get into an adult day program, they may be on the wait list for a few years, and that is because of the resources that those programs can access through the state. And so that skews the data significantly, which is wild that that is the system that it is, but it also makes our wait time look much higher. If we were to take those out, and we could do that for another meeting, just to sort of, if we take out the outlier, what are we looking at? That might be a better place to start that discussion.
Can I ask on that too, Amanda? I thought that, is it the same with the increased level of functioning? Wasn't that one we were going to kind of change the way it was worded? Because sometimes like same functioning is actually progress?
Yeah, so we did. In these outcomes, we've included maintained functioning
thank you
or
for-
increased functioning as almost a separate way to look at it. And so this is the first quarter that has the maintenance. Because maintenance isn't, I believe there's not a target for that yet, because we haven't established the target, but we are now asking about maintaining level of functioning. Because you're right, for some people, maintaining is the goal.
Right.
So we want to measure that and account for it.
That's okay, I'll get you.
Sorry. In this particular one, we didn't see kind of that balance. Now, it is the first time we're measuring it quite like this, but there were other areas where I didn't specifically go into this depth because it was long enough, but where we might have seen increase go down a little bit, but maintain went up. So we felt like overall, this is a positive, but this particular one, we weren't seeing that, where like the level of maintain didn't make up for the gap in the level of increase. And again, it's well, there is a historical trend for it, but we cannot conclude why at this point.
Okay.
More to come.
Thank you both. Did that cover the audit summary as well? Amy, I know you mentioned some numbers. Yeah, I thought so. Okay, just want to make sure. Any questions on that? Or else we can move on to 3D finance. Linda, I'll ask you, do you want to start it or hand it over to Melanie? Or
She's going to handle it
Okay.
because she's more on, she would prefer.
Yeah, and I thought I'd give you the opportunity though. So Melanie.
Okay, so the first thing I want to talk about is the fiscal year 26 fund balance spend down plan. As part of our fund balance policy, anytime we're over the 3-month reserve, we need to put a plan into place on how we plan to spend the funds down. And basically, this is also kind of how we determine our budget number for the next year. And so at present, once you take out the 3-month reserve, cash needs, and the amount budgeted to be utilized in fiscal year 26, which is 1.9 million, we have available fund balance of $5.3 million. What I'm proposing in the spend down plan is that we put $1.5 million of fund balance into the 27 budget to support additional client services. And then the remaining 3.8 million in fund balance would be there in holding for any emergency needs or just for future year use. So that's basically what this spend down plan says. We're not going to vote on it tonight. We will vote on it next month, but I just wanted to put it in there as kind of a point to start thinking and make sure everybody's comfortable with those numbers.
And can you go over that real quick on the timeline as well for especially the new members, like how we're right now discussing this, like so we know
Right.
at what points it's like more refined, it gets more refined as we go along?
So this month, we're presenting a draft budget, and we've got some items we're going to point out that we kind of need some guidance and direction on how you guys want to take it. But so next month, we will actually present the version of the budget for voting, and you'll vote on that budget. That doesn't mean we're locked into that. If, we make some tweaks down the road, we can still make some changes, but it would be then just on a per line basis rather than the whole document. So May, we will vote on the budget, and then in June and July, we have potential still to change the budget if things come up or we decide we want to go in different directions.
Great, thank you. Are there any questions on that as far as that's the spend down plan? Nope. All good? Okay, then the draft budget.
Okay, so then the next item, we're going to take a look at that draft 27 budget. And like I said, This is your first opportunity to see it, so there is time for discussion, time for changes to be made. I'm going to have us start out at page 5, the bottom of page 5. I always like to kind of look at the money we have to spend before we look at how we're going to spend it. So if you go down to page 5 and look at interest and investment income, you'll see that, we're budgeting significantly less interest income, and that's because, we currently in that interest-bearing account only have the $2 million of operating capital we're working with, instead of the $8 to $10 million we normally would have. So that's, I'm dropping down to $90,000 this year. As far as investment income, I don't have a good history for that, so I'm just putting in a $50,000 amount. In the first few months, we've had $9,000 of investment income. And that's kind of a hard one because our investment's not just income, it's also unrealized gains on the investment. So that's not to say we're only going to earn $50,000 on our investments. It's just that's the income component of it versus, gains on investments. So, so those are those two items. Then on page 6, we're going to look at actual income. We're not anticipating changing what we're charging for rent. So if we're fully occupied, we should be looking at about $156,000 in rental revenues. So no real change there. As far as sales tax revenue, this year we projected a 3.5% increase on the $10 million originally budgeted in '25. Well, we saw in '25 we got 11.1 million instead of the 10 million. So I'm not comfortable with still working off that $10 million number. But as Adam pointed out, he's also not comfortable with doing a 3.5% increase over the next few years without having any ideas. So what I'm proposing we do is for our projected revenue, we take the 11.1 million that we got for '25 and projecting an increase of 1.75 over a 2-year period. So 3.5% over 2 years, which would put us at 11.5 million is a rough estimate for revenue. So I'm more comfortable doing that because then if we earn that income and we get the income we're expecting, we'll actually use that income plus the fund balance we're budgeting rather than, not hitting that fund balance the way we want. So it also, enables us to budget more for client services. So that's where we're at. We're looking at a $13,348,000 in revenue for the year based on these numbers and utilizing that 1.5 million in fund balance. So any questions on revenue? Okay, well now we get to go and see how we're going to spend it. So now we're going to go back up to page 1. And the current personnel budget is basically our existing roster. We're budgeting for a 3.25% merit, which is what was approved by the county this year. And we're budgeting for an 8% health insurance potential increase. So overall, we're looking at an increase of just over $35,000 in personnel. This is subject to change. I still need some numbers from county. If there's also any discussions within our board as far as any changes to personnel as well. But that's where we're sitting if we maintain consistent staffing with those numbers. Any questions about personnel? All right. Then getting into administrative expenses, I'm, for the most part, budgeting consistent across the board for things. There are some things we're talking about potentially increasing, like training. We'd like to have some employees cross-trained in some software and some other things. So we're talking about a little over $4,000 increase in training expenses. For our insurance expenses and our director and liabilities insurance, I typically take the current year actual and then multiply it by a 10% increase. So that's where those numbers are coming from. On the next page, the only thing I really want to point out is We've put in money for a special study of $50,000 if we decide to do that community needs assessment. There's kind of a question right now if we would budget to do that in '27 or budget to do it in '28, the second year of the next 3-year plan, or if we kind of split that cost over 2 years, but we're potentially looking at a $50,000 cost for a study like that. So it's more right now a question of when we want to do it and whether it's going to be a 2-year expense or a 1-year. But that's just kind of in holding right now, so.
And can we put a pin in that one and talk? I would like Chris to be part of the conversation, so when she's here, whether it be, maybe even tomorrow if she doesn't come before the end of this, but I do want to talk about that a little further.
Okay, so on page 3, there was only really 2 items I wanted to point out in, well, 3. In building improvements, right now, I have put in the estimate for the lighting project if we did decide to put that into the budget. We're also seeking grant opportunities for that, so maybe we'll be able to fund it that way. Another thing is the transfers out for county maintenance support. We still have the potential where we might need to seek outside support for services instead of through the county, but we don't anticipate it being much more than what we're budgeting if we had county support, so that would just move to a different line item. And then light and power, we had talked last time at the COW about the change to our energy contract, and so we're budgeting a higher amount for electricity based on the unknown that we don't know what it's going to be. So that's it for this page, unless anybody had any questions.
Can I just add in, when she says we're seeking grants, we've actually applied for grants.
Yeah,
Great, thanks.
sure. All right. So nothing much on the next page. There's a few increases, but they're, based on history or potential gas increases. So basically now with that, we're looking at just a little over $12 million of administrative, or I'm sorry, not 12 million, that's more than our budget. I need my glasses tonight. 1.8 million. About 1.9 million in admin expenses, so about a 14% of our budget being admin right now. So that brings us into client services. So if we look at the bottom of page 4, some items to point out, we're looking at increasing marketing network promotions, doubling it to 16,000. And the reason would be potentially for rebranding of McHelp if we make some program changes there. And if we do that community needs assessment, it would be to promote that survey. Then also, another open item is the McHelp mobile app support. We're considering doing some, updates and stuff to that program, so the maintenance cost for that might be increasing. So that's kind of an unknown right now that might change. On page 5, one thing I did want to point out, with this increase in revenue is kind of an unsure thing. My thought was that we withhold, or not withhold, but hold back $500,000 in funding from the initial client service allocations to do at mid-year, so that if we see that the revenue is not coming in that we expected, or we see a need come up, that we have that $500,000 kind of set to the side to adjust based on what we're seeing for revenue or what we're seeing for needs. But one thing we could also consider with those mid-year funds is doing potentially a capital infrastructure NOFA at mid-year versus just doing, just doing additional fee-for-service funding. So that could also be an item for discussion. But then that takes us back to page 4. So we can look at client services in total. So the way the budget currently is, we're looking at a little over 11.4 million in total client service funding for the year. And that initial notice of funding availability would be 10.6 million, basically a $40,000 increase on what we allocated at the start of '26. And, when we had originally reviewed all the funding applications and made our allocations, we did not allocate $300,000 in the initial round. So, there is a potential that we wouldn't even allocate that full 10.6 in the first NOFA. So that's where we'd be working at. We'd be working at slightly above what we started out with this year, with the potential of that extra $500,000 in available funding for later in the year. So that's the big picture, and if anybody had any questions?
So I would, go ahead. No,
One more thing real quick. I kind of ran the numbers, what we've gotten so far for fiscal year '26. And for the first 2 months, we've gotten just under $2 million. So if we project it for the year going forward, if we were to get similar, we'd be looking at $11.9 million in sales tax revenue this year so far, just based on 2 months of data. So just kind of give you an idea.
So it's a comfortable estimation.
Yeah.
That you have. So feel free to jump in with questions. John, if you have one, and then I have specific items if we could, if people aren't jumping in. John?
Yeah, just the 500 holdback till mid-year, is that within, can we do that? Can we hold that much money out, from our general funds to just, for non-allocation and just on thinking we'll do it?
Well, it would be more a plan of definitely doing it, just kind of at a later point in the year rather than.
As the neediest might need from the shortages that will arise?
Yeah.
Or-
Well, what we can do is we can evaluate the applications we receive, and if we find that, we have a lot of good programs initially and we don't want to hold that back, we don't necessarily have to. We can, but that can kind of be a working plan.
Okay, I kind of like a contingency line item bucket.
And we've kind of, just to let you know, John, I think it might have been before you were on here, we put in place this mid-year allocation cycle, and it was kind of to allow that first half of the year to sort of drive where maybe some agencies may have, had an increase in need or maybe
An
less
emergency
need.
need or
or emergency
emerging need,
need.
yeah.
So to kind of give that, rather than everybody just has this set year, it gave a pause to let's reevaluate where everyone was. Think about it. They put in their NOFA in like July, right? We give the allocations in October, but they're projecting for that whole next year. So this kind of gives them a little bit of a reflection at that time. So we would use that money. We would use it. It would just be in the mid-year to reevaluate where everyone's at rather than, and we have put that into our process. We've formalized that. So instead of just, randomly giving it out, we do have that point in June that we would reevaluate everybody and they could come and ask and show that there's the need. It was off from their, literally it's like a year later that then they would have to reevaluate. So it's there and we'd use it. It's not like it's not dedicated to allocations. We would have a process, and we do have that in place to reallocate.
And I respect it, I do, but it almost, you hate to have an umbrella like that to where, hey, look, we have extra. Where can we spend it? Let's formulate an expense line.
No, it's not. Yeah, and that's not the case.
And I do see,
Yeah.
needs of funds from different allocate.
Well, that's why we could also, like I said, we could also consider doing a dedicated NOFA for capital needs that agencies might have too, is an alternative to, that mid-year, but just allocate it at mid-year.
I wouldn't argue this out. I can kind of understand it. I just wanted to, in my head.
Yeah, get the.
It's also the conservative approach of the sales tax data and seeing where that's coming in, because we really don't have enough data to see what happens if it doesn't come in consistently as it's been coming in. So I think that was part of that conversation to make sure that that's coming in consistently by that mid-year. So there's that side of it as well. And then making sure that it's coming in consistently. And then once it comes in consistently at that mid-year, and then going ahead and then the board making that decision whether you come in and use that for the fee-for-service or possibly a capital NOFA. right?
Because we did make that kind of commitment that we were going to stay flat for 3 years. So this allows us the opportunity to actually increase, but in a conservative way. Increase, but not overextend. So it gives us that sort of cushion to allow us to actually give out more than our original plan was, our original commitment to a 3-year plan was. So, and we're fortunate in that. And I just think it's at the same time committing to that 2 years before we really felt comfortable with making those decisions up front. So, yeah, I think, yeah. Tom?
Yes, maybe I missed something here, but wasn't, we just discussed the fund balance reserve spend down plan? We were going to withhold 1.5 million to be utilized to support client services in the fiscal year 2027 budget. Wouldn't that be something that we could use?
Well, that's
That's
part
on
of the
there.
revenue. If you
Yep.
look at the total revenue, that's part of that, the total spending is including that 1.5 million in fund balance.
And that, okay, so
Yep, on page
that's
6.
allocated, or is that being withheld?
That's part of what's being allocated. Yeah.
Okay.
It's part of
If
the
you
total
look on page
revenue we're
6 of the
projecting.
revenues, it's in as revenue. Yep.
Okay, so that's going to be allocated in NOFA?
Yes, it's included in the money, yep.
All right.
That will be allocated, yep. Yep. Linda?
I
page 6.
had
Tom, it's
the
on page
same
6.
concern, John, about having too much of a reserve. Sorry, excuse me. I had the same concern about that, and when I was talking to Melanie and Bridget today, we talked about the fact that, as I just said, taking a conservative approach before we just get all excited about what the sales tax is, until we see how consistent it is. And B, we are going to be discussing our strategic plan. And so this gives us an opportunity to say, you know what, maybe we should spend some of that because we've identified a need, whether it's a capital or a gap somewhere in the county's provision of some things we provide. Like we were talking at the last meeting, I watched it, I was not here, but talking about traumatic brain injury. So that's not something we currently provide. Is it a need? And so when we discuss our strategic goals, there may be an opportunity where we see that we want to fund something that's other than just provider dollars. And we're also looking at some of our quality indicators. And so, you know, maybe that, like, there may be an opportunity to say, we need to, you know, like, hire a position to look at finding a way to better integrate our agencies talking to each other, or maybe to hire somebody who would be looking for SILA locations and trying to do something for, you know, the county as a whole that's outside the purview of any one agency.
And if I could just take a second, because I know it's a couch. So to kind of put it into, for those, and this is for the benefit of those that weren't on here, must have been 2 years ago now when Lindsay you and Lindsay developed that. So Lindsay and Melanie and Carrie from the county did an excellent job, and we saw the last time how we're all in the green. When they first developed that plan, they did it with the flat funding for 3 years, which allowed us to actually not ever be in the red, but it put us in the yellow. So that's why we were very cautious of how we were going to proceed. And when we had approved that plan originally, we made the emphasis that we were going to stick to it because we didn't know the sales tax. So we really made that commitment to stick to that plan of the flat funding. We were fortunate that last year came in higher, that some of the fund balance wasn't utilized as we had predicted, so it went to green. But I personally, and I think that that's where staff is coming from, that sticking to that plan for that 3-year time that we've committed, and I mean, actually, we are making decisions to even increase it a little bit, so we are fortunate to be able to do that, but still doing it very cautiously, to not know, just not knowing what that sales tax dollar. And I think right now, you know, we saw that increase, but we're still that 2-year, really, until we have that 2-year set of data that we really aren't sure exactly where it's going to go. So Yeah, I appreciate the questions, but I think it's a really conservative approach and one that we can reevaluate, mid-year. So it gives us that opportunity to do that. And we'll do it this year. So before we really we're going to do a mid-year, right? The NOFA's after that. So we're going to do that process next month, correct? So you'll see kind of how that looks, and that's what we're talking about. So next May, we'll be talking about that because we're going to do it every year. So we'll see what that looks like, and then we can make decisions for next year of how we want that NOFA to look like. If we want it to include capital, we can do that. We can make those decisions next year. So I appreciate the input on that. I would like to have some input on a couple of the other areas that Melanie talked about. And I don't see any other specific lights, but some of the areas that we've talked about and I've talked about to Bridget and Melanie that I would like board input on is in training. I think we've talked about that before, and maybe when we get to strategic plan, we'll kind of get into training, but as was mentioned in Amy's report, maybe the training that we've been doing is maybe it's time to refresh it a little bit. So I just wanted to get everyone's thought on that. Even those numbers, I'm in support of actually, either continuing or even looking of ways or seeing if there's, I know there's the training budget for staff, but is there a separate one for?
Yeah, it's on page 5. No, it's on page
I thought I had it pointed out.
4.
Right.
Bottom of page 4, education network training, there's $50,000 budgeted.
So I'm actually, I like keeping that at a little bit of a higher level. I just wanted to point that one out because I know that one has been a little higher. I'm really in support of refreshing and seeing more community trainings and maybe putting that into strategic plan. But I do think that's an opportunity to get that exponential growth when we train and offer it to the community. And so that's one area. I just wanted to see if anyone had input on that or if they're good. Yeah, I just wanted to point out, Amy?
Yeah, are you, what specifically, are you about keeping it there, about raising it, about reallocating it a little bit? Like what input are you? I wouldn't necessarily want the number to decrease because I think that we provide really valuable services, but I do think that it's a great comment. You can only have so many QPR trainings before you don't really need to refresh those skills. So maybe it is taking a look at, is there something else that we could offer or a slightly different approach to training or something like that.
And that's kind of what I was getting at. I would like to leave it at least there, and then if during the strategic plan we find opportunities that really, really feel like would be beneficial to the community, I would be open to actually even increasing that area because I do think we need a refresh. I think there's a lot of conversations that we've been having that we can offer to the community. So I just want to maybe point it out and put a pin in it. So as we work through the strategic plan, you guys can kind of think in your head on what that training will look like, and if you feel like that's a good number, if you feel like it needs to go up. That one is just one area I think that could be open for discussion. We don't need to decide now. I just wanted to throw it out there, see if anyone had any comments, but continue to think about.
Okay. Yep.
And then another one of those two is, sorry, Jimmy, you're on my next screen. Go ahead.
Okay, I'm sorry.
Yep.
Would any of that training, and I would ask that it would be certified by NADAC, National Association of Professional Training for Addiction and Behavioral Health Services. Many of our counselors and therapists get continuing education through NADAC, and that I know many of the different workshops that I participate in and have done that becomes part of reimbursements too. That people will come to our program because they get certification or get continuing ed through NADAC. And I don't know whether that would be appropriate for us to help support. Yeah, is that right? No.
So right now, we don't have certified by NADAC, but we do have a lot of IODAPCA,
Yes.
which is what Illinois requires for the CADC licensure. So it's an option, and we can certainly look at it, but right now we kind of focus on the state certification.
Yeah, so that would be, yeah.
Yeah.
That's a state certification for continuing ed that you need to have every 3 years or whatever it is. I can't tell you. I'm now retired to do that.
So that
I'm
too
an
could be,
American,
I
whatever
mean,
that is.
and I don't know how we want to address it when we get into a strategic plan, but I know this will be an area we'll want to talk about. So I
It's
just
a way
wanted
we
to
can
kind of,
expand those trainings, yeah.
yeah, get the brains kind of moving on that. Linda?
The other thing that I had talked about with people was a lot of the comments of concerns for people about the mental health care in the county was affordability. And there are a lot of people who are perhaps insured but underfunded, either because they're underinsured or because they don't have any disposable income. You know, they're barely making ends meet, and the insurance doesn't cover it all, so then they can't make the difference. So another kind of community education could be something that provides safe places, support groups, and some education for self-care for people who are struggling with issues like anxiety or depression.
And I will lead that into a transition of one of my next topics, which is the McHelp app. So just want to throw it out there on this one too, because there were some options in here on, and I'm sorry if I'm going off the rails here, but on where the support, there was the potential increase to bump a revamp of that app. So kind of wanted, and that could be something incorporated. Like, do we incorporate support groups into that app? Do we invest into McHelp to kind of give it a refresh and offer more information into it? So that we've kind of had those conversations. I don't know if anyone wants to weigh in now, but I do want to point it out because I think we need to have those conversations. Amy.
Yes. I have two very strong, like almost opposing opinions on that. On the one side, I think that app very much needs to be redone. I think it's fine, but I think there's so much more we could do with that particular app. So I do not disagree with the idea. On the other hand, I don't know that this next fiscal year is necessarily the right timing, given some of the other initiatives that we have going on, like our increase in social outreach, which, again, like I say, these opinions kind of, are opposed to each other. Increase in social could mean that we revamp the app and that feeds into our social program, but it's just having the bodies to do the work to focus on them. I would hate to do it part way and then feel like, oh, well, now in 27, we got to redo it again because we missed the mark this time. So my only concern with that is when we would fit it in with timing, and does it necessarily make sense as something to take on over the next 12 months, or could it continue to be fine until, 18 to 24 months from now? That's my only comment on that. I think it's a great idea. My only concern, again, is when is the appropriate time for it, that we won't strain ourselves too thin with some of the other programs and initiatives that we've got going on.
And so this is for 2027, so it would be.
The next, yes, right. No, not this year.
So it could
but
cover, yeah.
Yeah, okay,
Yeah,
yes.
so those are great comments. So we just, I think, need to make that, keep that in mind as this budget moves forward. I know, like right now, it's kind of, but just keep it in mind on the money. And I don't know if you want it more solid than that, Bridget?
Do you want me to
Melanie?
speak to that?
Sure.
So we've had conversations with the McHelp app creator, and we are looking to get quotes and timelines. As far as capacity, the quotes would come with them initiating and creating and being the implementation. And then once they put all of the stuff in place, the maintenance then would be on them as well, and then the maintenance fees might go up a little bit. So yeah, so we wouldn't be the bodies doing all of that. So this app, from our opinion, needs to evolve. It's stagnant. Some of the initial parts of it, they can do at no charge, but some of it really does need to evolve. So that is the parts that you need to choose. How much do you want it to evolve? When do you want it to evolve? We can get those quotes, and then you can make those choices from there. But as far as capacity-wise for the staff, that would be something that the McHelp app creators would do. Yeah.
Yep, if you touch it, there you go, okay.
No, and thank you, that it is really helpful to understand, that the technology would sit with technologists who would build it. I do, and that does assuage my fears somewhat, but I think part of the design in the way in which you select providers and make sure that all the information is up to date, like some of the information feeding into the app, we should spend a bit of time on, but realizing that needs to happen anyway and perhaps could happen as a part of the audit process that's ongoing and might naturally feed into other things that are going on. But no, that is really good insight, so thank you, I appreciate it. And I am in agreement. I'm not against updating that app at all.
And that would change drastically. It wouldn't be just feeding straight to our website. It would be changed drastically. So I can give you that assurance. Yeah.
John?
I was looking for that word evolve, because, I mean, this has to be tweaked, if you will, all the time. And I could see in 2 years, AI will probably be able to do it for us, but right now, I would totally agree that you have to keep on that, because the longer you leave it, now you're going to have to throw it away and start over. I would, yeah.
And I appreciate all those comments. I'm wondering if we almost need like a little sub-working group on this issue. Would you be comfortable? Would that be good? Okay. So I will throw it out there. If you are interested, let me know. And you don't need to let me know now, but I know Amy is definitely. But I will then. In the near future, then I can just get a small group of you guys together and work with Bridget on how that will evolve. So. Okay, thank you for weighing in on that one. The next one I have is, since Chris is back, we were talking and we were waiting for you to return, so actually if we could add her to the roll, sorry, I'm sure you already have, but I will acknowledge her, and that we were talking about the community needs assessment under special studies. And Melanie, did you want to kind of talk about the two different options that we may have?
Right. So the question was the timing of the special study or the special needs assessment, whether it's something we wanted to, say, start the planning of in 27, where we, select the vendor, develop the surveys, but then actually launch the surveys and collect the data in 28 so that we have a finished product in 29 when we start developing the next 3-year plan. So then potentially we could be spreading the cost over 27 and 28, or just focus on doing it all in 28 and putting the cost in that budget. So that's kind of the question, whether we wanted to kind of spearhead it to be spread over 2 years, or whether, 27 is not the best year, or 28 is the better year, as far as the timing of when we want that information available.
Yep, I would like if you have comments. Oh, there you are.
Yeah, I'm happy to explore the options. I was not envisioning us hiring somebody to do that. I was envisioning us doing it ourselves, because I can do it, actually. So
How much time do you need?
But I think that there's a lot of, it's really just a matter not so much of a lot of new surveys, so much so as compiling much of the information that is already present and trying to ascertain, where does this give us information that we need?
Asking
and
the
where
right
might
questions.
some more specifically targeted information gathering be necessary, and that could potentially be done through a survey that we develop, which I have the capability to do, or some focus groups. So that's what I was originally envisioning. So I'm not gonna, if other people want to do a bigger, more independent project, I'm not going to be opposed to that, but that's not kind of what I was originally thinking we might be looking at.
Yeah, I don't know if, okay, Bridget, do you have?
I would say then have that conversation under your strategic plan discussions then.
That would be great. And sorry, I'm writing in my thoughts, 1 second. Okay, yeah, if we could do that then, and then Chris, you could give us great feedback on that. Okay, anything else on the budget, the draft budget? Oh, one last thing, the lighting project. Does anyone have any input on that one? Because I think there was a question mark on that one too. Or do you need that now, or do you want us to?
Well, I know we'd had the conversation, John brought up the point of doing it over phases, which is also an option. Doing, say, the front building 1 year, the first floor another year, and the second floor a third year. So that's another thing to consider.
We don't have to say now, but if you have opinions now, happy to take them, or else, as we move through this draft, if you have any opinions one way or another, if you could express them, that would be great. All right, any other last call on the finance? All right, then we will move on to the workshop, what we've all been waiting for, with the strategic plan discussion. Everyone received, hopefully, all the information of the surveys that came back. I will turn it over to Bridget in just a second. I'm going to just kind of give it a layout. She can kind of give a brief overview of the information we got back. How I envision this then going is we talked about those 4 goals when we had board development day. They were included in the information that you had received with goal 1. Let me make sure well, do we want to just discuss the format first? Well, I'll say. So we're going to go over the goals. We want to solidify those 4 goals, that those are the ones you're comfortable moving forward. And again, like right now, it's the draft. So, if there's tweaking here and there, or exactly how it's worded, we can always do that, as this evolves. We don't need to necessarily have that set in stone today. But the whole goal concept, we do need to solidify. Once we have those 4 goals, and I'll let her explain, but then we'll be comfortable with those 4 goals, then we will go through and develop objectives within those goals. So we can start with goal 1, to develop objectives, and then action steps can be discussed under there as well. We're hoping to get through goals 1 and 2 at least tonight, and then tomorrow we can go through goal 3 and 4. So anything more you want to add?
No, I don't think so. I mean, was everybody able to access the OneDrive? I hope. That's the first part of it. Did you want to start with all the goals first, or just do goal 1 and?
Well, what I'd like to just do is, just go through all of them first. That is what they are, so then we know.
Yeah. So we'll start with the goals, and then we have a template, and Melanie has pulled it up. And so then we kind of have some prompts within each of those goals. And those are just really talking points. Those are not set in stone. Those are for all of you to start with. And then those can be modified, those can be talked about, those are going to be as we move along. Amanda and I are going to be standing up here and just putting down those ideas for you. And then as we get moving along, we can then create the drafts. We can come back tomorrow with different stuff as we go along. Melanie, maybe keep your microphone on and read that stuff as we go along so that we can then right as we go along. Will that work?
That's great. And I just first wanted to acknowledge, 267 surveys? Yes, so that was great. So, if you've took notes along the way too, make sure we incorporate. I mean, I have notes of ones that stood out to me, so we want to make sure they get incorporated somewhere within these goals. But starting with the goals, I'll just refresh everyone's memory that goal 1 was collaboration, advocacy, and awareness. Goal 2 was accountability and quality. Goal 3 was access and coordination. Goal 4 was community resource development. So since that time, and for those that weren't here, is everyone comfortable, or is any suggestions on these goals of how they may look differently, or what you might want to include into one of them, or word differently? Oh, sorry.
I want to say one other thing. As you're looking at this spreadsheet, you're going to see green. The green is indicated, it's some suggestions that were called out on that survey. Okay, so the main things that were called out in the survey. We indicated that. And then Chris had stated that we had this data that we had come through at the town hall every year, and we really never did anything with it. So we had staff pull that together and see what that overlapping information was. So I hope you saw that on the OneDrive as well.
Yep.
So,
Yeah, great, thank you. So discussion on those goals. Does anyone have anything they wanted to add or change or say in the 4 goals that we have set forward? Are we ready to just get to work? All right, we're good. Awesome. Okay, so goal 1 is collaboration, advocacy, and awareness. So examples of are up there as to why, and I can read it out because I have it in front of me too. So objective 1, and again, these are just suggestions of, we need to develop the objectives within those, and we don't need all 5. We can, I think 5 max is a good number to have within there. So objective 1, though, suggestion, encourage partnerships and collaboration, funded agencies, outside organizations, et cetera. Objective 2, which is in the green there, states increasing various social supports through collaboration. And objective 3, or did I say 2? Sorry. Objective 2 was that. And objective 3 is also in the green, states awareness. So I don't know how you guys want to do it, if anyone has suggestions. Do we want to just see if an objective 1, and see what people think about it? Or if you have any thoughts and we can add? Does anyone have any, did they think about these to begin with? Chris, come on. Well, under goal 1 is collaboration, advocacy, and awareness. So what would objectives that we would have be to obtain that goal?
Definable?
Sure.
Because it's a very hard goal, right?
Yes, that would be great. Well, and so I will let you know this too, actually even taking a step back. Everybody included in that drive also, we had the last 3 strategic plans that were included in there. So if you had the opportunity to look at them, they all looked very different. And some of them were more concise than others. Some of them had a lot of words and paragraphs. I'm kind of more of a concise individual, so it's what you mentioned about defining them may be a good opportunity for us to have that goal, but then have that background information there to really define that goal without having all, like 4 pages of paragraphs before. Just get right to the goal, what it means, what we're going to do about it, and then have these objectives within there. I think, we can incorporate the action steps, and then as far as where those action steps are going to be accomplished within those next 3 years, I really kind of look to staff to do that. But if anyone has any thoughts on that, we can jump in on it. I just think that they know their capacity and how they can, what they can handle and when. So I think that's a great suggestion of defining that goal. So collaboration, advocacy, and awareness, or I guess what we're trying to accomplish from it too, might be a good discussion. Anyone want to jump in? Okay. Oh, Tom beat you to it, so. Tom.
Are you looking to carry forward from the previous strategic plan any of our goals or objectives? Because I looked through it and I'm trying to catch up here, but did we meet all of them? Or what's the data on where we stand in accomplishing those goals from our previous strategic plan?
So if you recall from Board Development Day,
Yeah.
we had that discussion on what was still remaining.
Right.
And we did not necessarily accomplish all of them, but then at the same time, some of them were like infinite, so they weren't really obtainable.
Right.
Or, there was no definitive accomplishment there. So we can carry forward. You can use it as kind of ideas if you feel they need to be incorporated, but how I view it is this is now planning for our next 3 years.
Right.
So if you feel like some are still applicable and they need to be carried over, great. But I don't know that there's any, Bridget, if you had any specifics that you feel, but I think when we went through board development, it was either like, we're going to accomplish this by the end of the year, or we're going to remove it because it's not it doesn't have a real finite way to accomplish it. I think we were kind of set in that. So if you have specifics, though, we're willing to, we can incorporate it.
That's how we understood that.
Yeah, I felt like we kind of put that one to bed at the,
Yeah, that we were going to, carry out what we had, or we were going to forego them.
right,
All right, thank you.
sure. Linda.
I have a
Oh, sorry. Linda.
I do have a question. Some of the comments that providers specifically made, and actually community members made, are things that are possibly outside of our control. And I just want to point that out to people, because like in an ideal world, we could craft a perfect, system, but it's not an ideal world, and there are limited dollars. And also, some of the stuff I feel like we are already doing. And I don't know if that gets, I know this is a strategic plan for the future, but do we highlight any place to the community what we have accomplished in some of these areas?
I think that's our annual report does that.
Okay.
I do think that two things that you said really stand out to me. One being, areas that may not be within our necessarily actionable item actually falls under this collaboration piece, because then I think this is an opportunity to use that as an objective of making relationships and collaborating with other outside agencies to actually fulfill some of the needs of the community. So that actually would fall right within what we're talking about.
So one of the things that the providers had mentioned is, and I sort of think we do it, but that they mention it concerns me, because they must feel it's not effective. But when they were asked if it was effective, they said, the majority of people said that collaboration and coordination between our organization and other their organization and other services is somewhat effective. So what they were recommending is shared referral systems and a centralized care navigation support.
Which is, so if you look at that first one, I don't know if you can see it, but under Objective 1, where it says encourage partnerships and collaborations, that's like the outside organization. So one of the action steps within there is actually IRIS implementation, which is, we have had that kind of approved for a while. So that would actually meet exactly what you're talking about.
That's why I said some of it I think we have done at least in part, and so I think it's a good goal to say, okay, for example, if they don't think it's working well, do we need more training, or do we need, you know what I mean? What do we need to do to improve what we already have, I guess?
Perfect example of something that was on the strategic plan that will now carry forward to this strategic plan. And then we have to, realize how we're going to finish it in this next 3-year strategic plan. So.
And I wanted to add to when you had said things that we might do that they don't know. I think that also falls into this area of just that awareness piece of it. I mean, I think that's a big part of it as well. So not only what we do, but maybe what others do all fall under this awareness. So those are kind of, that's, you're falling right in line here. It's working right now. So that's exactly, what we're going to be doing here. So I'll get the comments and then we can solidify it more. So Jimmy.
Oh, I want to echo that big time. But I also think, too, being on numerous boards, that I think there's somehow, and I know we deal with executives or CEOs of local agencies, but really, I work with NATAP, which is National Association of Treatment Providers. And really, the way they're getting people to work together is getting board leadership to work together. That collaboration that we do between different treatment providers, we open up a door, or there's no wrong door. We would say in treatment work or addiction or mental health work, there's no wrong door to find help and support, but really encouraging board leadership to meet each other, or different treatment providers, board leadership to work with each other, because it really comes down from the top in many ways as they see reimbursements or appropriate finances and everything. It all comes that way. So I don't know if we engage board leadership, at a Rosecrans or at an Ascension, to say, hey, we would like you folks to come together and, if we have a day gathering, and then they learn how to work with each other. This is the key to everything we do, is collaboration and relationship.
Yeah, that's a great suggestion.
Yep.
Amy.
Yes, so to give us a couple things specific to react to, and you can laugh if these are like way off base, but for the IRIS implementation, what if, and again, throwing this out for reaction, but as a part of the 3-year plan, we had a 90% adoption rate across the network of Iris and do like 30, 60, 90, so year one, 30. I don't know if those numbers are realistic, but just to be able to give us something to specifically measure against, come up with some numeric goal of.
So, yeah, and I actually think we don't even, I mean, I
Don't need to give that
I don't even think that, because, well, when, in our conversations on Iris, so what was in there, we just actually met with an agency and the potential of what this would look like and how we would implement it. So our contract that and I think it's been probably, 2 years? Then we kind of approved this as the board. And was included in that was that all, like 30 providers were going to, or 30 agencies were going to be
Okay.
in there. But we feel like that's just not, it doesn't make sense.
Too high?
No,
Yeah,
it's way
okay.
too low,
Yeah.
because we
Oh,
want
too
it to
low?
be
Okay.
all-inclusive. Like, our goal
Yes.
should be, like, everybody that
Everybody.
wants to be in it should be in it.
Yes,
Yeah,
I
it's like,
agree.
we're the county mental health board, we're not just like our network's mental health board. And
Right.
I mean, individuals need access to all the services within the county, and they need, and the agencies want to have access to all the agencies in it. So we were talking about, I don't think that's unrealistic, to just have everybody who wants to be part of it. We just need to see what that dollar amount looks like, is
Right.
kind of what we're waiting.
Okay.
So that will probably drive more that percentage based on how much it's going to cost, I would think.
I don't think it's going to be hard to have people come, have a seat at the table and say, I don't think we'll be knocking on people's door to sign up. I think they'll be knocking on ours.
So do one of you want to, and I don't know who's most appropriate, do you guys want to just explain what Iris is for like new board members? Because I'm guessing some of them might not know.
Iris is a referral system for providers, where if I'm a provider and I have client Bridget in my office and she's telling me she needs housing and daycare for her child, I can reach out to Iris, there's a network of my local providers. I can say, client looking for X, Y, and Z, has this kind of insurance, lives within this boundary, and I need referrals. And then what will happen is she'll sign a release for me to do this, and then once she's in Iris, an organization sees her and will call her. So she doesn't have to be calling. That's one of the biggest barriers to treatment, is that calling. So the provider would contact her, and then the provider would get on Iris and let me know they picked her up. So it closes the loop, which is really, really nice, because then I'm not following up with all these other providers. It's a really effective system, and it's used pretty regionally. So Kane County has it, DuPage County has it, Will County has it. And the providers have been asking for it.
Okay.
Which is why I don't think we're going to have any.
We'll have, okay.
30 will sign up right now.
And I like the idea of including non-funded providers.
We do not have it.
You have, I mean, really, in order for it to work, you have to include, yes,
Everyone.
Chris, sorry.
Wait. Sorry, I had a couple more, sorry. I had two more. For the shared services, do we want, again, spitballing, do we want to set some kind of referral out goal? That, is it at all reasonable to go, like, based on the size of your organization or something like that? Like, we would expecting Rosecrans, based on who they see, to have X percentage of connections across other networks. So I don't know if that is use of Iris, but something, again, I'm looking for something concrete that isn't just you referred people out, but some sort of, is there a realistic, based on if you are actually really reaching out and connecting with the community, you should be doing X number of reach outs a year or something like that.
Iris specific?
Not just Irish specific, but some kind of,
I think that, and the shared services one, and I'll jump in, sorry, because and if it's not what you're thinking, so I think maybe more of a, and it's a good idea to include specifics on there, but it might be more, and we were having the conversation earlier today about what that shared service would look like, and it's us, injecting that conversation into others, not looking to them, but saying, do we need shared services of HR? for the, different agencies? Or do you need an insurance pool for the agencies? So it might be very specific,
Okay.
like, do we want to say shared services in 3 areas might be a good goal to put in there. And then what those 3 areas look like may be refined more as the strategic plan goes. But, yeah, we can put a number if we want to have, at least 3 areas of shared services that we focus on. I mean, right now, transportation is obviously one
Yeah,
that
it's a
we've been
big one.
working on.
Yeah.
Yeah, there's a
that
lot.
makes sense.
Individually, if you pull your funds.
I was not thinking about it through that lens, but thank you.
Yeah, I know, you were thinking a little differently.
thinking differently.
So I think
No,
that's
thank
more
you.
what we're speaking of in this one, not putting it on them, but looking what opportunities there might be for us to
shared
kind of
pool?
house
Okay.
that.
Right.
Yeah.
'Cause that's getting a little, yeah.
One more, sorry, and then I will promise I will turn it over. So is, this might happen with like the monthly meeting where everybody comes in, but what about to foster kind of a collaboration and an understanding of what other people do? And this would be hard to implement. I hate to put more time on people's calendars, but some kind of like shadowing program with our funded providers, or some idea where, somebody that is normally at options and advocacy, and I'm picking them out of the air, I'm not picking on them for any particular reason, would go to NISRA or something and spend a day there understanding, getting more depth with that. Like thinking maybe more junior staff or something, because I'm sure that, at the more senior levels, everybody kind of knows everybody, but is there sort of that idea just to spread that kind of awareness, or maybe having, in terms of community building, like when we were at Home of the Sparrow today, they were talking about having other agencies come in and talk, like trying to build that out in more of a formalized program across providers, but some idea of actually having them connected with each other where the people they're serving are impacted as well. Does that make sense, what I'm?
It does, and if I could just jump in for a second, and feel free to weigh in on this. So what I did find in other strategic plans were sort of action items like that, like having a provider do this or a provider do that. How I view a strategic plan is what we can do, like what our goal is. So not asking more of our providers, not asking for them to do anything, but more like what can we do? So maybe if you feel like we can facilitate some sort of a network, I mean, we do have, maybe it's an evolution of our network council, putting that within the strategic plan, but not putting any sort of action items onto the providers themselves. So stuff that's outside of our control. Like we need to put in what we can control and focus on what we can control. And so correct me if your vision's different, but.
I agree with you. I'd be afraid of burdening our providers anymore, but I agree with you in some way of sort of connecting them. So now we have decided that we are, a member of every chamber in our county, right? So now maybe we have a multi-chamber event where we get all of our providers together, and that's how we connect them, and that's on us to do that. So we're putting that burden on us, not the burden on the providers. That's how I would see that, instead of putting the burden on the provider. Maybe that?
Also, and I don't know that maybe everyone's aware of this, but at the QMT meeting, we highlight different providers and they present. So at that meeting, it's not so much the executive staff, it really is more boots on the ground. So they are learning about what the other services are. So on some level, and that is the majority of the meeting. I mean, they interact quite a bit, which is nice to see. So that does kind of hit that, but it is interesting to think about maybe the mental health board would look at hosting an open house at a provider and invite the chambers there.
Right.
So
Right.
we're inviting the community. If we could work with the provider to invite the community in, that creates kind of what you're getting at.
And it's an interesting point because one change we made this year that came from the executive directors of the providers was our intake coordinators meetings are now, some of them are in person. And they made that request. And so their intake coordinators meetings are in person. Four of them are in person now. So their intake coordinators are here meeting in person. And that was their choice. So there is some of that desire, but again, we have to be careful how much we're pushing some of that.
Or I think like asking them to our meetings, like every meeting, invite, however many we have and however many meetings we have, and give them, 3 to 5 minutes or whatever to introduce themselves, say what they do. I mean, we do it when it comes to allocations, but if we actually invited them and got them on the calendar, then it would be great to get that in-depth information. So maybe, and that's something that we more have in our control of extending that invitation, and then it's up to them rather than burdening them. So, yeah, but great, thank you. Chris?
I think it's a great idea, and I love seeing the ideas evolve about, going out to agencies and chambers and bringing people to our meetings. I think those are wonderful. I just wanted to take another step back and talk about IRIS for another minute. So I think that part of the IRIS is not just going to be, let's, put down money or whatever. I think we also have to think about rollout and implementation. I don't know what our role will be in this, but it's, even though, King County, Camden County, they're using it, provides a lot of good, there's probably no perfect utility out there, and some people think it's a pain in the neck, and use of it fluctuates over the course of time by actual users. So, just kind of putting it out there and assuming there's going to be uptake without adequate kind of like preparation is a little bit worrisome to me. So I want to make sure that, the agencies want it, they're going to use it, that the administration and the agencies is going to promote the use of the utility within their agencies, and that they have adequate resources for professional development around it.
Almost like a training for the agencies too, and like a round table almost.
Commitment from the agency too, saying they're going to.
Well, it's all voluntary. I mean, IRIS they have to want to be part of it. So they volunteer to be part of it, so.
I feel like to measure success, you would have to have something like, nothing's just sitting there, like nothing went into IRIS and then it just died. Because then the system isn't.
Yeah, you need like usage.
What should we do? Like in order to be a funded provider, I know that there's some stuff that's out of our control, I'm sorry. I feel like I'm talking too much, I'm sorry.
Yep, this is what we're doing.
I agree with what Chris is saying, though. Like, if we're putting in, to give that wonderful example, somebody was looking for an apartment and we never heard about it. If that was me, I would be so soured on going to, McHenry County doesn't really care. I went and I gave them all this information and then no one called me anyway. And I do feel like, at least with our funded providers, if we're bringing IRIS to them, does that become an additional part of the audit? Like, what kind of insight do we have into what's sitting in IRIS? I know that that's more work, but if we see something and we're like, objectively speaking, this was in your domain and nothing happened with it, that's kind of a mark against you. Or do we close the bounds of IRIS? Like, there's no longer housing referrals, it's only mental health. But I think I see what you're saying, and it's not just, yes, it's a great idea, but.
Build it and they will come, I'm not sure.
Yeah, no, I work in technology. It doesn't, that doesn't happen.
It is worth considering creating a goal that is multi-year, right? So implementation is 1 year, evaluation is a second year, and what that could look like. That's worth considering, and it's a pretty standard way to go.
Does it get feedback like that? Will it give us that feedback of referrals that went out and areas that they went into?
You can run reports on it. I don't know how much. I don't know what those reports look like.
Okay. All right, great. Okay, I have nobody right now. So let's they're writing and putting some under those objectives, but so kind of in that first one where it says encourage partnerships and collaboration, funded agencies, outside organizations, and then that's where we had the IRIS. There was this suggestion of some sort of board leadership in there. I do think, just maybe even, I always use it like a job fair, is what I always think. Like at the chamber, I mean, when Bridget talked about the chamber event, if we did a multi-chamber event here, I just envision the providers like lining the entire, perimeter of this room, and people can go to those providers and, maybe whoever wants to talk can give a little thing about theirs. I mean, that's how I envision it. That could be done with board leadership too. Maybe that's just a general, provide at least twice a year some sort of collaborative, I don't know what we even call it, like fair, like that, resource fair, or however we want to. We have PIN, that we're part of. So I don't know. I think that would fall under there, and that falls under. Then shared services, we talked about, just defining those. Stop me if I'm assuming Linda. Okay, I'll let you talk now. Let me stop.
Well, I had a thought, because one of the other issues that the providers brought up was turnover, and that part of our delay in services is that we don't have enough providers. And we've talked about just like certain services like pediatric or the traumatic brain injury or autism. There just aren't providers offering some of that. So I wonder if we could use your fair idea, or even an education idea like Jimmy was talking about, to offer to people who are currently students in social services or in other counties, and open it up to a bigger group to be sort of a draw to providers. So like this collaboration is us working with other people and increasing awareness. We can increase awareness of what we do here in McHenry County, the quality that it is as a draw to bring other people who are providers to the county. So I don't know if that fits into this at all or not.
In that portion, yeah, I think.
We used to do nursing seminars, and nursing actually has a thing that's called magnet hospitals, and they're defined by high quality that draws nurses from other areas and keeps nurses functioning because they like having a voice in what's happening in nursing in their organization. So it's a higher quality, and I think we do provide good quality in McHenry. If we're having innovations like Iris that are, I know they're being used other places probably, but just like if we're doing these things, I think that it can be a draw for other people, and we can improve the quality of services here by offering things to non-funded providers, people from outside our own area.
And I think some of that falls under the access and coordination too. Yeah. Yep.
Right. Workforce, we had that conversation today with an agency, so.
Yeah, that would fall under more of those, so that's great though. But I'm thinking, sorry, Tom, 1 second. Network fairs might be like a good kind of way to put it. Okay, Tom.
I was listening to what Lynn was saying about bringing in providers that would treat certain things that we may find unnecessary and fill a gap. And also on the surveys, one of the providers said recruitment and retention of employees, getting not enough people. In one of the previous objectives on our strategic plan was internship program. Bringing in interns to work within our providers, or even here on our board. I don't know when the last time was we had an intern. But to have that is something that's a viable option to increase the number of workers that are willing to come into McHenry County is something to explore.
Do you have any thoughts on that one, Bridget? I mean, I know I saw that one on there, and again, like if we wanted to do it here, or if we wanted to have like a point, if others wanted to come into and say, we're looking for an intern and we wanted to facilitate, I think we could do that. I don't know. I mean, I find it a little challenging in that, again, like we can't clear the space for them. We could have one here.
Right.
I don't know how much we do because we don't provide, but. Right, we could maybe offer like a portal for it if, something like that, but.
We used to have a space on the website for internships, but again, once what Chris said, it used it didn't get updated. And so then what we did was we just provide a link to where agencies can now update their internship areas. So it is challenging keeping that updated for agencies, but it is something to explore. It's a difficult one, because I think some places are just going away from some of that. Open for discussion.
Oh, Chris, I'm going to turn it to Chris, because she's in that space.
So there are a lot of interns. There are a lot of interns. Like, I teach at a school of social work, right? We have, I think, over 800 agencies that we're working with right now. The challenge is that what students want is paid internships. So this is where, us and workforce development and our grant writer can work together to put together some scholarship money, bring in, programs. If there's funding for workforce development, there's a lot of interest in like peer navigation, programs for that. But all these programs require internships, and that's where it falls apart, is because the funding for the internships isn't there. So if we can fix that part, then we'll be able to continue to build internship resources in the community.
And thank you, Amanda, for putting in that. I was writing here, but we may be, working our way through everything. Yeah, because just because I personally have a daughter who, they gave her a list of a couple hundred of them where she had a, interview with. And so the schools, if they're in for it, they have programs that they actually do. But yes, so Amy.
Yes. Yep, I'll say it. I feel like now it's a little silly, just given the discussion that we just had, but.
Nothing is silly.
Nothing is silly.
It's not.
But like a hub or, cow ties are, yes, yeah. I didn't wear mine. For the, so that kind of the other side of it. So for the providers, a central, and it would have to be updated and blah, 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 but not so much a list of internships, but a list of like career fairs or job fairs, or like this is when MCC has their days, even if we gave it basic information. And this you could probably pull with AI, honestly. You just have to train it a little bit. But like, it's usually held in this month. There's no cost for you to attend, or there is a $100 fee for you to have a table. That kind of information, so that it would be sort of a one-stop shop for our providers to go out and say, okay, I'm going to make sure that we have a booth here, I'm going to have a person here. Even like on something like a college night, like, hey, take a gap year, and you don't have to have a paid internship because you're just a high school student. Now, maybe what you can do is very limited, but if you have an interest in that way, it might be a win-win. So.
And some of that is pulled to our hot sheets, but we can increase that,
Right.
So, paid internships.
Did you turn off?
I turned it off.
Okay. I'm just going to take a pause for a second real quick. Feel free, I'm not offended. Steph was so kind as to bring snacks, so feel free if you're hungry as we go through. They don't want anyone hangry while we're doing this, so feel free to grab. Don't get offended, or if you need to use the restroom, whatever. It's free flowing. Okay, Jimmy.
Thank you for this great discussion and leading this. I really appreciate this. A little bit, that I would think about, even when you talk about schools, is I remember years, and I don't know if they still do it.
Oh, I thought he was.
I don't know if they still
I'm sorry.
Thank you for the discussion
I'm
and leading it, if I may
Yeah.
be as bold again. My question is too, I probably get close to 10 calls a month from different clergy. I don't mean to be walking to that ballpark and get myself in trouble again, but because people in the community know, different faith denominations know, that I'm involved in addiction or behavioral health, mental health, and understand some of those resources. That would also be another community resource development piece, that if we could train some of our folks, I'm the old guy in the club now, I know that, but they're young folks, guys and gals that come into the community, they really get calls all the time. What do I do with my niece or my nephew or grandparents are constantly dealing with that. I hear that often. That may be an area, but we do a lot of work with our social workers in the school districts too, I would imagine. That is another avenue between our psychiatrists and social workers in the school districts, I would imagine. Do we do more stuff there? I don't know if we're doing stuff with.
And that is one of the, further on down under access and coordination is expand youth services. That's one specific. It says explore ways to partner with schools,
Yes.
early childhood organizations,
Right.
and underserved age groups.
Good, yeah, so it's
so
there.
that will be under number 3. So
Okay,
that's great.
thank you. Yeah, no, that's just but go for those clergy folks. Because I'm telling you, every Sunday, they're in buildings all over the place looking for help.
And that one too can fall under 3 on that one too, under expansion of services to underserved areas. And specifically, it says identify partners.
Right.
So that is one partner
Certainly,
that
there yeah.
could be included in.
Because there are a lot of 12-step programs in those buildings too.
Well, and to that point, engaging volunteers, that's another untapped source. Because there are a lot of volunteers out there that reach out that just don't know the avenue. And
Right.
you have to have capacity in order to filter volunteers.
That would be a huge one, honestly.
You have to have a volunteer coordinator.
Yeah, that would be huge.
This is the first meeting I've been to without items and objections.
I know. I was going to say, Tom keeps turning on and off and on and off and on and off. So I see it.
Sometimes you let other people talk it out.
Well, why don't we do this? Because I don't have, unless Jimmy, did you have something else you wanted
No,
to say right now?
but what John said too, it's about evolving. And I think that word, John, was perfect. It was, we're evolving.
So going back to goal number 1, we had that I think the encouraging partnerships and collaboration funded agencies and outside organizations is a very good objective within that, of which we have defined those. I don't know if we want to, just include in action items those shared services, IRIS implementation, some sort of like networking resource type fairs in that. So, and then objective 2, which was one specifically identified within the community surveys or the other surveys, the provider surveys too that went out, was increasing various social supports through collaboration. And that had support groups, community-wide trainings. I think we've talked about, both of those. Chris, you look confused.
I'm trying to envision, it seems like kind of broad, so I'm just looking.
Right, so if you're, looking to refine that, it also various social supports through collaboration. So I think on that one, I was going to say, if you want, I think it's like recognizing that there's stuff that we might not be able to
Yeah.
address.
There were a lot of things on the surveys that came back that are outside of our scope. Thank you. Housing and transportation were the first 2. Those were also, housing and transportation were also talked about in board development. So we've got these 2 things that are popping up. And so maybe the board wants to look at 1 or 2, which is why it's vague, because that's something you guys would have to decide. And then we could create, like identify partners in transportation or identify partners in housing and then create action steps regarding that. So it's vague because you guys could probably decide where you want to go with that. Housing and transportation came up in those surveys over and over and over and over and over. And it comes up in everything that we do, but it's sort of.
Like the social supports is like, that's not what I don't think of as social support when I'm thinking housing and transportation, so.
Yeah.
I saw them as 2
Yes.
things, and I was trying to drill down on those.
So I think the
I
request is.
think like peer support was kind of where those are, like it was peer support. There was like caregiver support. I thought like supportive care were some of the ones that stood out to me in those surveys. And kind of, centralizing, I feel like a lot of it's on peer support, but then some of it's like, caregivers who even are new. And I think they kind of go hand in hand on support groups and community-wide trainings that we've talked about, like, especially as you have aging parents and then, the children taking care of aging parents, support groups for those individuals, or training on even like how can they access other outside organizations that can help relieve them. I just think about like my own parent who, like, how do you even access things that you can get, or who do you even reach out? Like hospice, I know, is a big one that people don't realize. Like hospice is not necessarily end of life care. It's like, there's other options within that, and then they get you connected with insurance that covers things, and just different supportive care. So like maybe having that type of training, or even just different peer support groups that can create those social networks together. And that was just one that kept popping up in the survey, was that family. I think in the IDD community, they have similar, exactly. So that's what I was thinking of on those. I don't know if anyone. Yep. Chris.
So I'm wondering the extent to which this is us providing training versus we're not going to provide, so they're already, NAMI has support groups, and I think Senior Services has, caregiver support, and we just had a caregiver conference, last week? Last week. So I'm like, are we looking for services that could be housed within our providers that people don't know about? Or in some cases, maybe they want, more or a different kind of service. So I'm trying to suss out, you want to point to what's what's the mental health board's role? And so I think here you're saying that maybe this is part of our, I don't know.
I think maybe it's actually, it ties those two together. I think it actually ties the increasing support groups through collaboration together with the awareness. So I think that maybe even in that first action step is identify the gaps that may exist. If they already exist, it kind of goes to that awareness of, if it's already existing in another agency, whether in network or out of network, then we raise that awareness to them, or we help, get that word out. If it doesn't and there's a gap, then we can provide either that training, which we were talking about, kind of revamping the way trainings look and maybe doing some community-based trainings. So that could be like one of the action. Then if we find a gap, we can do a community-based training, and what that may be would be where that gap is. Or if there's not a support group that exists for that within another identifiable agency within the county, then we can provide resources or try to create that partnership, and where might be the most appropriate, either I mean, we're not really going to provide the support group, but we would provide, maybe try to make those connections to do that. Yeah, the training we could. Trainings we can, for sure. But creating those support groups, we wouldn't necessarily create the support groups, but we could find gaps that exist and then create the partnerships of, to encourage those support groups. And then we could provide that awareness. So it all kind of ties together within those. And on the awareness, then you do social media, like with the McHelp, how we were talking about that. McHelp incorporates into that. So it's not only what we have, but it's, the outside areas really should be incorporated into McHelp as well. And then under the awareness is also promotion of existing services in and out of network. So I really feel like those two objectives within that goal really work in tandem with one another. So maybe even under increasing various social supports through collaboration on the action items, maybe even the first step needs to be identify within the community, various gaps that may exist, or, to see, is there a family caregiver support? If there is family caregiver support, then we need to put that into awareness, and how do we now make people aware of that that's available within the community? Because, and I don't know if I've said it at the board, I should have brought my diagram, my little image, Bridget, my wheel. Because how I envision it, and I don't know this, and I think I have said this before, like how we're this hubcap of, the mental health board is this hubcap, and then all these different spokes of, agencies, government entities, it could be, faith-based organizations, whatever these different spokes within our community that all will work together. We can be the central point of information and collaboration, but it really takes these spokes to be, reaching out to that wheel in order for us to all move forward. So, we're nothing if we're just sitting there in the middle. But if we're sitting there in the middle and can tie all these other spokes together, we actually can get moving. So I'll bring my little graphic I created for the county, my little AI. Oh, Melanie's going to pull it up for me. That's my visual I always have, that we might not be able to provide the peer support, or we might not be able to have the support group here, but we can identify those or where they're needed, and we can make the connections with the others that do have it. So I think maybe before, in that even the first action is identify if there's gaps, or identify where they might be, and then bring the awareness, or else fill those gaps. Oh, I'm sorry, Linda, and I'm talking and ignoring. So Linda.
No, I just put it on. In collaboration with what you're saying, I think the awareness on this ties in with access coordination and also development and deployment. We're talking about upgrading McHelp. We're talking about taking marketing inside. And so some of, like if you were to ask Joe Citizen what resources are available, they're going to be pretty limited. So when we are talking about taking our marketing in-house, we need to look at and put it in somewhere here, whether it's in goal 1 or goal 3, to put in here that we need to basically market ourselves in what is provided in the county. Since we're not care providers, we're not marketing ourselves so much as we are marketing. We have ways to connect you with providers and with help, and there are a lot of ways in our county. And if you don't know about it, a good starting point is, and that is not just for the community. That is also for the social workers at the schools and the counselors at the schools. A lot of them are walking around trying to do things themselves or not, when there are agencies they could be referring to, and they may not know about it.
And I appreciate that comment, and I just want to add on to that. It can be in both. I mean, it really can. Awareness is probably one that could actually fall into all of them if we wanted to, and I don't have a problem doing that. And then what does that look like under each of those goals? What does that awareness piece look like? So it's actually probably not a bad thing to put kind of a theme into some of them. I don't know how you feel about it, but
I think awareness is probably one of the biggest things,
yeah.
biggest problem in the county when it comes to all.
And the surveys show that.
Absolutely.
Even if we already do it, people don't know that we do it. So Amy.
Absolutely on that same theme. Maybe one of the objectives would be to, because going off of the recommendation of involving clergy, but taking it more broad, identifying additional public opportunities for us to represent or speak about the mental health board. This could be other places of worship, not just clergy, locally owned businesses, asking them to please make sure that they have something representing that there are, mental health board or services or something like that. Like if you're within McHenry County and you're a locally owned business, or even doesn't have to be locally owned, could be franchises, but so that would be more representation as opposed to speaking about, but local realtors is another one. Like I have a very good friend who's a realtor who sells a lot of houses and still is afraid to even mention the McHelp app because she doesn't want to give a bad impression about mental health. It's my own personal battle to fight, but, can we keep showing our faces at, chambers of commerce, right? Like, I think that we absolutely do a lot. We do a lot, but I think that there are still other opportunities, and maybe the objective is to identify what some of those are and folding them into our schedule to raise awareness. So that's one. Second, and this came to me as we were talking about it, what if we rebranded McHelp and called it something like Central Resources, or something that wasn't, that maybe was a little bit more catchy? If we're going to be looking at the app anyway, is it worth it to have some kind of, does it need an updated name or a catchier name or a more inviting name or something, maybe considering that as a part of that effort too.
Great. I think it's a great conversation to be had. I think we've been calling it Milk Health for so many years. Do you want to rename it? That's a good question. I mean, it's a good conversation to be had, but if you are going to rebrand it and send it back out there again, why not? I think it's a great conversation to start. I think it's a great conversation.
I just know
Why not?
I'm sorry I turned my mic off, but I just know from talking about it with people that sometimes you have to explain what McHelp is. You're like, there's so much in there. I don't have a better name right now, and I'm not saying we should, but
Yeah.
maybe think about it.
I also think it's very intimidating.
Spend so much money on Nick, that.
Yeah.
No, seriously, they do though, in their branding of McHenry County. I think Nick is something that I would keep it.
Yeah, and also, I think it's intimidating the way that it is right now. That first button is very intimidating to get past. So the first part of McHelp is opening that first button up to 2 buttons. So I'm a young kid and I'm sitting in a room and I can hit that first button that just says, I can just talk to somebody. I don't have to be in crisis to talk to somebody. That's the first part right off the bat. And then we can talk from then and there. But that's just one little tiny thing that should be changed with McHelp. Yeah, and back to what you were saying, one really great awareness thing that Deanna do you mind if I bring this up, has offered to do is to go out to some of the ribbon cuttings that are coming up and talk about the mental health board and bring some packaging for us and represent the mental health board. These are the little things that we're changing because now that we are part of all the chambers, she's going to get up there and help get the word out about the mental health board. So, yeah.
Kind of organize the things you talked about under objective and action to see if that helps.
Yeah, and I'm thinking, so I just before Amy mentioned about identifying opportunities for new partnerships. I actually think that's even a new objective.
Yeah.
Like I think that under goal 1, I think maybe an objective 4 is like we had encouraged partnerships and collaborations, funded agencies and arts-led organizations, but I feel like identifying opportunities for new partnerships or collaboration is almost a separate objective because that's almost like then how she had put it as seeking out those partnerships, finding opportunities, I think is.
Right. So then that would be also the drawing the providers into the county, right?
Yeah, I think that could fit together. So I think that feels like an objective 4 there. Chris?
Agreed.
I think I want to make 2 points if I can remember what they are.
I'm sorry.
The first one is goal 1 says collaboration, advocacy, and awareness. And we've been talking a lot about collaboration and a lot about awareness and not as much about advocacy. So when we, like it says example housing transportation. So, I think under social supports, we've been talking about training and support groups. It's a little bit different from looking at like us engaging in advocacy to create structures within the community that we find not to be sufficiently present here in terms of like permanent supported housing and in terms of things like transportation. And I've talked some before about the fact that it troubles me that the PUNS list that people are not moved off the PUNS list to receive Medicaid, home and community-based choice waivers quickly enough. And so they can't get day services, they can't get residential services, and that we, as a mental health board, try to support the needs of people with intellectual disabilities. And yet, this is a thing that they're eligible for. Medicaid should pay for these services, and there is a consent decree to try to increase the rapidity of people moving off this list of eligibility into actual service receipt, and that is not being implemented, as quickly as we would like. And so how do we work with providers, the ARC, the state, to try to put into place the funding and the resources that people in our community need? That's not just support groups, it's concrete supports. And I don't know if that's the same, it strikes me as a different objective than the social supports piece. I don't know if it's the wording that's different. So that's in my mind in terms of like how do we, and you and I have met around housing needs in the community. And I know you've explored extensively transportation needs within the community. So us engaging, not to do it ourselves, but to, lend the strength of our voice to work with other entities that are also interested in this and working on it to come together to try to create, kind of support their work and engage the community with that work. So that's one thing that was in my mind. Other thing that's in my mind is a lot of the stuff that we're talking about relates to the needs assessment, because you're saying, increase various social supports, and you're saying find out where they don't exist. Well, that's part of the needs assessment too. So obviously the goals are going to be interrelated somewhat, but I just kind of wanted to point out that opportunities for new partnerships is also based on needs assessments. So, I don't know in terms of rolling out the goals or creating task plans, some needs exploration might need to happen first before we're able to do some of the tasks connected to some of these objectives with this goal. So
And I think that's a really good point, that actually that needs assessment should probably be incorporated into this as one of the objectives within. I don't know. That's what I was just going to ask you.
I don't know. I looked at it. That's why I was looking at the goals. I'm like, I don't know exactly where it goes.
I was almost thinking like access and coordination is maybe what, just like access is, yeah, that's what I'm thinking. I do think that's a really, really good objective to put under there. And then maybe on like a timeline, maybe that, gets moved into, what was it, like 27, 28, if we, or if we start having those discussions, and if we, I'd look to you for some guidance on that, since you're willing to kind of work on that, on a timeline. No, I know, but if we have those conversations, maybe in 27, start those discussions, then maybe by like mid-28, we can have some clear guidance, and then you can start implementing those that it may be dependent on those into that 28, 29 year, I guess is what in 29. But I do think that's a really good one to put as an objective under that access and awareness. And on your first point, how Bridget and I have been kind of referring to it is we're injecting ourselves into conversations. So I don't know if that's like a better way of putting that as far as an objective, but like we did with housing, like we've done with transportation. We're continuing to do that, and it kind of goes with awareness, but I feel like it's also an objective in when we object ourselves into those conversations, be it at the state level or the local level or wherever it may be, then I feel like maybe we can put some action steps in there, and in the way of housing or transportation, or maybe we can get more specific. And I just feel like that's kind of what I'm looking to do. I don't know if you have better wording or what people want to put in there, but I do think that kind of goes in there. I don't know, thoughts? So you guys know what we mean? Oh, sorry. Oh, wow. Okay, you guys, there's, it does. Okay,
So
I'm
I was
excited
going to
about
say, and there's a lot of these things we may shuffle around because a lot of them do apply under multiple categories. Goal 4, which is community resource development and deployment. The first goal that you have listed here is identify solutions to gaps. And I think going off of what Chris just said, our needs assessment, identifying gaps in our needs assessment is part of our 3-year plan, and it should really be up there because we are talking about doing it in the next couple of years. So.
Okay, Adam.
Okay, so I'll talk, John.
Then it's your turn, John.
We're talking about chambers of commerce and going and visiting and rebranding and changing the name of the app and doing all these things. I think if we start going to some village board meetings and getting on their agenda and doing the presentation of the rebranding and saying, hey, you guys know what's in your town. Help us figure out what you guys need. And if it's a trip to, Algonquin, Lake in the Hills, Crystal Lake, get on their agenda, say, we want to come, we want to talk about what we're doing, to let the board know, because they're getting all this feedback too. Their individual village boards are getting this feedback. You're talking about injecting ourselves into these situations, and I think this is going to help figure out where our goals are going to be this year, maybe not this year, but next year. And it's going to take time to get on those agendas and say, hey, we want to do 20 minutes, 10 minutes presentation, whatever. And if it's us going to the meeting or staff presenting, because I don't think I should be presenting, because I'll wear my cow tie.
You're very articulate.
But I think that's very something that can help facilitate. We're talking about these gaps, and what is the village seeing? What is Harvard is going to be seeing a lot different things than Crystal Lake or Algonquin. Okay, and so, and again, we aren't able to fix everything. I've been hearing that since I got here. We're not going to be able to do it. It's just not possible. We're going to try to do the best that we can. And there's a lot of things that people don't know and don't understand. And, well, I didn't know this was out there. That we don't have these services. And again, we talked about the scope. It's not there all the time. And sometimes it's just not realistic. I'd like to have $1 million. Yeah, well, it's not realistic, But those are the kind of things that I think that there's some misunderstanding in getting into these. People go, well, what does the mental health board do? We don't do what it sounds like we do. That's the biggest misconception. And if you start with that as your title slide, we're the mental health board. What do we do?
We have a graphic for it already.
Yeah, I know, but we don't do what people think we do, and this is the problem. If someone comes up in crisis here, what's the protocol here at the front desk? You're calling 911.
Call 988.
But I mean, essentially that's the same thing. But this is the problem, is that there's a misnomer and a misunderstanding about that. So I think if we start getting to these chambers of commerce meetings, you get to going to the ribbon cuttings, I think that's a little more individualized things, maybe for a provider or something like that, but I think you're going to get more traction at a Chamber of Commerce meeting or a village board meeting. And it may stir more conversations. That's also going to help once we rebrand the app, whatever we're going to call it. That's our time to advertise it and get it out there and leave them a brochure. Hey, do me a favor, put this out on your monthly newsletter. Here's services. Come here for this and do that. That's it.
Oops, sorry. Jimmy?
I would agree wholeheartedly to put together if we could put together some type of a professional PowerPoint, that it would be done and have somebody from the board with a staff member to go. But really, as board members, that we should be there to say, we've been appointed by the county, and we'd have a staff member with us. So it would be, a give and take in a way conversation, but very focused PowerPoint. And I think that's a great idea. Thank you very much for that insight.
I appreciate it. I literally have dreamt about that at night, so it's, so I appreciate that you said that. No, so I put it on here, so that's great. Amy?
This is more of a question. It might be an idea. I think by we, I mean more like McHelp or our resources, but are we in like bars and doctors' offices and tattoo parlors and stuff like are we there? Like bookshops? Like I'm thinking about just where are people, like doctors' offices. Like I know that we've done outreaches, and I think we've done a great job even while I've been here in getting into schools and stuff like that, because I know youth outreach was a big one. And I'm sure that, Northern Illinois and places like that are in some of the places that I just mentioned, but are we getting the centralized resource out there?
As far as are we in, do you mean by a flyer and they're...
Like a flyer, or a lot of doctors' offices, it's in the bathroom, something like that. Yeah.
We are, as far as emailing and dropping off and mailing, as far as we can get them to actually put it out there, yes. us delivering a flyer and taping it on a door, no. But we have sent it to schools, we have sent examples, we sent it to libraries, legislators. We send it all over the place via email, actually physically sending them out. Whether they hang them,
Yeah, we can't.
we don't have control over that. We have thousands and thousands of the small bookmarks. We get it
Right.
on a regular basis. We're gearing up to do another mailing via email and physical mailing. So yeah, it goes out on a regular basis. I can't tell you specifically how many people have come in here, but
Yeah.
we're constantly changing those lists and sending it out to many places.
Like I've seen it at the library and, yeah,
Libraries,
yeah.
and all those places.
Okay.
So, but I would be open to as many different lists as you suggest, because, yeah, get it out as many places as we can. Our providers help us as well, too.
Oh, yeah, absolutely. Okay.
And so many things come to mind when we open these discussions, like what Adam said, and all of us. But like, what we do in our messaging, going to the cities and the villages and saying, this is your money. A portion of every tax dollar comes to us to distribute to the providers that provide for the mental health and, transportation and everything that we do. But I mean, our lane is distributing money too, though. Right? It's not, I am not here to, roll up your sleeve. I'm here to tell you where to go. They'll roll up your sleeve. Even today at my office, what are you doing? Well, I have another meeting, mental health board. What are you doing at the mental health board? Well, we distribute money. I am not a mental health, I couldn't help you. I couldn't even talk my wife through a Band-Aid. But that being said, our lane is distributing money and helping them, right, get awareness. But I think that the public going into Crystal Lake and McHenry and letting everyone know is, McHenry County has changed the way we do things. Every part of your dollar goes to what we do to help, the people that are in need and indigent in this county. You should use us. I think that's our lane.
Well, I will say, John, a key piece of it, though, that we have not really been addressing in the Community Mental Health Act is actually specifically in there is collaboration is a key component of what the Community Mental Health Act does specify. We just haven't done that. And I mean, and you're familiar, kind of, county board and mindset and shared services. I mean, we do get those dollars for allocation, but I think that mindset needs to shift. And forgive me, because I sat on a municipal capacity committee for 2 years, but dollars are limited, and we all acknowledge that. Like our dollars are limited, so we needed to now shift to really focusing on this collaboration piece of the Community Mental Health Act. That it is one of our duties is to actually create those partnerships and collaborations and access, not just through dollars, but through relationships. So I think that is a way to maximize the work that we do without necessarily spending more.
And speaking to that specifically, I mean, over the last few months, the county has gotten a lot of our information out for us through Thrive, through their newsletter, through emails, and that has not, we haven't been able to use that resource as much in the past, and that has been really a great partnership. McDonald's coming to our town hall this year. That's been a great partnership as well.
Yeah.
So those are the partnerships that we really do need to talk about, those collaborations. That's what we should be talking about, so county and other agencies.
And just naively putting it out there, because I'm not saying I know what, but my thought is, like what you said, Adam, is when somebody gets a call here, an emergency call, who do you call? You don't say, come on in. You call 911, right? Or someone that's going to help.
And you're right, that awareness clearly needs to indicate that we are not a service provider.
Right.
Yeah, and I think that education is definitely a key piece of those.
Providing the
Yes.
services that
Yes.
providers need, and that's the money.
Yes, and you're correct, and that is a misconception about many. So I'm going to have Jim comment, and then I'm going to move on to the next one, so.
Yeah, I would agree that we don't want to silo. I've seen too many facilities, treatment centers, providers silo. This is what we do. And our role is really to integrate all that, John, absolutely. It's like, but I even think if we ever get into Iris, I mean, you could do a pamphlet that says, call Iris. Do you know who Iris is? And inside of that pamphlet would be, these are the different people that you can go to. I mean, that just, I think that's just I'm surprised we didn't have that. But
Yeah, I think that's a great connection piece that we're working on.
Thank
So,
you. Jen?
so thank you. And we're having a robust conversation, which I really appreciate. I really, all these comments, and I apologize that it's not as structured, but I think, they're doing a great job keeping track, and I'm filling in some stuff here too. So what I'd like to do, I'm kind of shooting for maybe like the next 7:30ish, and then continue to tomorrow. But before we end, I would like to go to goal 2, so what I'm thinking, let's try to cover goal 2 and have that discussion. Then I'll, maybe we can even meet tomorrow, maybe Bridget, and I'm assuming they're going to kind of coordinate. I have thoughts put down. If anyone has anything you want to have into this, and then kind of redo this spreadsheet for tomorrow. And then we'll look through it, see what we agree with, see what we need to add, because mine's filling up. On all 4 goals. So it will give us then a guide for tomorrow as to where we'll be. So if we can, but 2, I feel like we haven't really talked about is goal 2, that accountability and quality. So under the objectives, and Melanie has them pulled up on the screen, under objective 1 is evidence-based practices, promote use and provide training. Objective 2 is explore shifting outcomes reporting. Objective 3 is useful data. I think another objective we talked about that could go under there is awareness. It could fall under all of those. So does anyone have any thoughts on what that might look like, if there's another objective they feel like needs to be under there, or action items under those objectives? And again, it could be a free-flowing conversation, and we can keep notes as we go to put them in the appropriate area. So Linda, I will go to you.
Can you explain the second one under this goal?
So explore shifting outcomes reporting.
To be diagnosis-based? Yeah, I'm not sure what that means.
We talked about that.
Yeah.
So, in the last 6 months, we've talked about looking at our outcomes, and are we really measuring what we want to measure? Are we getting data that we're not doing anything with? And we've talked about potential of, with our CARF accreditation ending, can we look at what we're collecting, and are we collecting stuff because of that accreditation? And so I think really looking at what outcomes we want to look at and really examine and dig deep in, and consider whether that needs to shift.
And then the second question that goes with that is this, like, I'm real interested in this, like my nurse self, my busybody self, I'll research this, I'll look some of this up. But really, shouldn't our providers be providing what current benchmarks are? And can we, it's sort of asking them to do more, but it's also asking them to help us. We're asking questions that we're not getting good answers to in quality. Like, are we asking the wrong question? And we need to do that interactively, I think, with the providers. And also, are they happy, not just happy with the questions, are they thinking we're asking them questions that are really showing outcomes that matter? Like, maybe they have different concepts of what we should be evaluating, because sometimes somebody else writes your goals and you're like, you're missing the mark for us. And so maybe they need to give us that feedback.
It goes back to, are these groups wrong, right? Are there certain outcomes that are skewing data, like the wait lists, and so yes.
So I guess what I'm saying, when it comes to accountability and quality, I think I think it demands some interaction with our providers. I also mentioned to you today at the hospital, when they started surveying hospitals and putting their satisfaction ratings on there, they told all the staff, we got in-serviced. You need to, script your conversations. When you walk out of a room and tell somebody to put a gown on, I'm pulling the curtain for your privacy. Because when they got the question about privacy, they didn't know that we had done anything for their privacy, even though everybody was doing it. So I think, just doing this quality issue with the providers can improve patient satisfaction, because they'll see that things are being done for them because we're talking about it with them. But that requires, interaction with our providers. It's not just us that would accomplish this.
Can I look at, there was also something that we had talked about.
We talked about educating not only providers, but educating staff.
Right.
Correct.
Also, I think under this, we talked about potentially considering breaking out outcomes to be based on sort of the 3 pillars of the mental health board. So right now, our outcomes are lumped together, and this came out of board development, I believe. Our outcomes are lumped together, so we're considering mental health and developmental disability and substance abuse all together. And that alone skews the data, right? Because like the wait list is a perfect example. And there's going to be, and then we have opioid settlement fund, which is substance abuse, but it's only a few programs. So like considering looking at the data by sort of pillar instead of lumping it all together.
So perhaps our goal could be, what we're talking about doing is reevaluating our current benchmarks and quality measurements. That could be one of our goals.
Looking for comments.
Yeah,
So
or
waiting for
it's,
comments.
no, we have, oh,
Yeah.
I don't know if that seems.
what was it? I'm sorry,
It's
quality
big,
out.
but-
Reevaluating and, I don't remember what second word I used, but reevaluating our current benchmarks and goals.
Oh,
Like we want to remain, and that is one of our, our mission statement is to lead and contract for quality behavioral health. And like what's quality? That kind of definition changes as there's more research. Like what's the current standard of care changes. And we're not supposed to define that for our providers, but we are supposed to encourage them to be seeking that. And seeing if they're meeting that standard. But it's going to require some interaction with them, so, in my opinion.
Thanks, Amy.
Yep. A couple of thoughts on that. I absolutely think we need to continue the great work that is done in interacting with providers. I think the idea, always open to revisiting measurement, absolutely always. And are we looking at the right outcomes? Is there something that we're not asking you, or do you have a particular outcome, XYZ provider, that you don't see represented? Another thought, when we are looking at data and what can be very disparate data from a very large group of organizations that do different things, is that you need some common metrics, and our outcomes are based on different kinds of standards. They're not necessarily all just things that we sat in a room and made up. But I think that education and that understanding of the history of why certain metrics are used or others, but part of the reason that it's at the state that it's in now is so that there's a understood fairness in the way outcomes are looked at. Well, you look at this provider this way, but then you look at this provider this way, and it's maybe a little bit easier to game the data or to only report favorable data. Or how are we then able, as a board, because we are a funding organization, like we need sort of that central way to be able to determine good, bad, So I think we just need to continue to keep that lens. but I always open to revisiting, but I wouldn't want to go down the lane of being so specialized that, I mean, my report was several minutes long already. Like, how do we have any kind of apples to apples comparison, knowing that, you know, we're doing mental health, IDD, and substance abuse disorder. So we need to balance it like that. But I am also always all for organizations being able to show off, you know, this outcome. Like, I know Warp Core is one where it's difficult for them to come with outcomes, and it is, I think, very rightfully so, a way that we need to continue to push them. But I also want them to be able to feel good about, this is what we're doing, even though it's not necessarily on your list. So I think we do need a balance there. But Chris, I know you also have
Yeah, can I just follow up on that point? That's a really good point on the outcomes, because as we've talked before, and as we're kind of shifting from this just mental health to mental wellness is the conversation we've been had. And I think Warp Core is one of them. It's, and a couple programs have come, that prevention aspect is really hard to quantify in those outcomes. So inclusive in that would be like how, you know, shifting the outcomes reporting might need to incorporate a little bit of the prevention aspect, and how do you quantify that? Chris?
I was going to say that.
I'm sorry.
So just for context, you know, I actually talked with Scott Block when he created the structure that we've been using, right? And the purpose that he had was, like, we are a program. You know, we have, I guess, our lane is to, you know, give away money. The purpose of the money is to positively impact the community and reduce mental health symptoms and reduce substance use and increase, you know, access to services for people with intellectual disabilities. So, you know, he wanted to find, like, his objective was to find a common way to evaluate the outcomes across all of these different sectors within which we're providing funding. And he used the SAMHSA framework, which is a rational and well, you know, substantiated way to do it. I think what we're finding as we move forward is that in some instances, these categories are so large, like improve or maintain functioning. That's so large that it's very difficult to know, have we been successful? And if not, why not, and what do we do about it? So the purposes of program evaluation is to say, okay, in what instances did you succeed, and find out why, so you keep doing that. But then also figure out in what instances did it not work, so we can fix it, right? So we don't have the data that we need now to do that. And so we do, you know, I think it does make sense for us to reformulate how we evaluate the impact of our services, because we're not able to use our data right now to really guide decision-making. I think we've gone very big. We also don't want to go very, very small, so everybody has like their own little bespoke, you know, program evaluation. And there's probably a space in between. Many of our providers are trying to reduce mental health symptoms. You know, have you reduced mental health symptoms? It's a good question. For whom? How much? So, yeah, I think that it's a good goal. I don't think it's evidence-based practices, and I don't know if it's reevaluating current benchmarks and goals. It's reevaluating our entire program evaluation. And I really appreciate everybody's focus on just doing it in a way that is meaningful for the provider. You know, so a mental health provider wants to know if they have reduced symptoms among the participants in their program. You know, we have some, you know, prevention providers like consumer credit counseling, you know, trying to keep people financially stable is a way to reduce the likelihood of onset of mental health symptoms or reduce exacerbation of mental health symptoms. So there are prevention roles in here. Harder to measure, fair. That's okay. So I think maybe the conceptual, like, benchmarks come out of redefining how we measure outcomes. Like, after we figure out how to measure the outcome, then we'll figure out, is it appropriate to set a benchmark and what should that be? We got to work a little bit on how we measure those outcomes first.
I would agree with that wholeheartedly. No, seriously, because truly, I mean, you know, 8 people that are volunteering to go and change the world is unrealistic. But to describe how the people that we're helping financially and make sure that they're.
Oh, sorry, John, can you just click your button? We all want to hear what you have to say. Click your button.
Sure.
There you go. Okay, continue.
Well, a team of a volunteer board, I don't think should be like tasked to do the work. I think, what you said, Christina, should be to describe and accountability to the people that we provide the help from, financial help, to make sure that they're accountable to themselves for saying, are you doing what you're supposed to be doing, so we can feel good about spending the tax dollar money and giving you more, or do we spend it a different direction? I think that as a board, setting up a policy or structure for Bridget to go forth with to, help everybody that we can. But I don't think that as our job, aside from going to the providers or maybe the village halls and reminding them that, hey, look, your tax dollars come to us for distribution. And don't forget, if you have a need, let us know so we know where to send it. But I kind of picture us more that way.
Adam.
Here's the second time for you, John. When we talk about accountability, we do that with our audits, and I had an email exchange with Amanda about an organization about how they were doing a specific procedure, and it doesn't matter. It's just that there's different interpretations. If I say I'm going to do this, I'm going to wash the dishes, okay? Something as simple as that. What is your vision of washing the dishes? Everyone's going to have a little bit different interpretation. Are you putting soap on the sponge? Are you rinsing it off? Are you throwing it in the dishwasher? Are you running the dishwasher? There's different levels of accountability that happens there. And I think that happens with our audits, and we need to be following through on that. And just to go back to our outcomes, I think it's important we maintain some sort of a broad scope rather than getting it so small, and that would help with reporting. And we're just going to say, okay, and we can have that be small if we identify a problem. But I can tell you that my experiences with people in recovery, anybody in here used to smoke? Okay, I quit cold turkey one day, said I'm done. And there's people that just can't do that. So everybody is different. And so when we have success stories, when you talk about alcoholics, and I made it through till 7:30 tonight, okay? Their next goal might be 8 o'clock. It may not be the next day. It might be that next hour. So I think that's important. When we look at, when we're doing what we're doing, we're double checking what our funded agencies are supposed to be doing through these audits. And it's important to remember too that even though a funded agency comes back, and I have a lot of questions about numbers and statistics, I go to the Substance Awareness Coalition meeting once a month. That's actually held in this room, and they have outcomes. Well, those outcomes are different every month. The numbers are different. What they're looking at are different every month. They're not comparing the same thing every month. So we don't know how many people were assisted or we manipulated. We did 700 text messages. All right, well, I text with my daughter who's 14. I get K. Does that count as a text message? And if I'm lucky, if I get that, So I think it's important that those numbers can be manipulated, and we can't get stuck on that, and just have a broad scope and say, hey, when you're talking about we were talking about earlier, we were talking about the 30, 60, 90, maybe just quarter after quarter increase, maybe not specify, because you lock yourselves into those things, and there's questions about what we're not doing or what are we not addressing. I think most of the people understand that we are faced with an impossible task, and it's important to remind kindly, I should say, that we're doing the best that we can with what we have. And this whole meeting here, this whole cow discussion is we're trying to make it better. And this is going to be an ever-changing goal that we have to be able to be flexible. And, you know, okay, I can tell you right now, in my career, all has been pumped at me is opioids. Okay? Opioids are not going away, but they are sunsetting. And we got to start worrying about the next thing. And I've been talking about it for like 6 or 7 years. And you're starting to see that increase in other things. And this is the challenge that we're going to have. We're going to have to pivot a little bit and change that. But I think it's important that we understand that we're doing everything we can do and doing the things that we're supposed to be doing. And we can only do so much. If we go to all the funded agencies and say, what do you need? We're going to get 300 different responses. And then we have to kind of figure that out where we're going to go. So.
Thank you, and I'm going to turn on Tom's mic before he backs out again.
I promise
out.
all I had this time. I liked your comment, Adam, not to be so specific, generalize it. And I think that if we have collaboration with our other county boards that are out there, we can really mine some of their data too and how they gather it. There's also agencies within Illinois that collect data, and I don't want to see that we're overlapping our work, is that we can mine some of this data that statewide agencies or national organizations are collecting that would be useful to us and use them as a means of ensuring quality and accountability. I know that McHenry County has kind of a own little area there that might overlap with other state counties, but certainly some of that information that's collected out there by our other agencies can be useful to us. And collaboration, how do other mental health boards gather their data and use it? You know, can we collaborate with them and use some of that to be useful to us?
Great, yeah. You can put that under, that'd be great. Thanks. You're good? You turned yourself off. Okay. Amy. No. Tom. Amy. You're up.
Okay. This is super specific. It's super specific, and it came into my mind, and I hope I'm not too off target. Was working was online with an agency today. We all know chatbots, right? It was not helpful. It was actually a discouraging experience to try to work. It was a funded provider to try to interact with this chatbot to see if I could get to a human through the chatbot. I feel like we have to form an opinion on if you are using non-human resources to interact with the public. We need to set some expectations around that. I feel like. Or maybe be a thought leader on that. Like, I know that's a little off the rails in terms of being funding, but I also do feel like it falls under the no wrong referral sort of broad umbrella that we need to get ahead of that because whenever it's strapped for dollars and we don't have resources and, we don't want to pay a person to sit and go through emails because it's a huge savings to have that initial AI triage. I want us to at least think about, do we have a position on what good looks like for agencies that are doing that? And I'm not even talking about trying to provide, like talking to ChatGPT and having them diagnose your autism or whatever for you, because that happens too. But just that front end administrative, I think it belongs somewhere. Maybe not in the strategic plan, but I think it's something we need to think about.
I think that's a really good point. I don't think we've talked about that. And I mean, I do think that, this is an area that even when they've done kind of these evaluations of where AI is going to take over the human aspect, this is one space that has been really determined that AI shouldn't replace. So I think that's a good thought to maybe we can put that and stress that somewhere in here. I mean, it's remove, and I think it also, one of the things that stood out to me was in reviewing the community surveys was that social isolation piece. And that's one of the things I was trying to figure out, where does that even fit in here? Because, that's all over the board. That's all areas. It's not just in the youth category, which we had, but it's in, the seniors and the aging population. And I think that fits in with AI as a component of that social isolation. So we'll have to find somewhere to put it. Okay, there we go. So what I'd like to do now, since I said 7:30 and we're 2 minutes past, but I appreciate that this was a really great discussion. No, I think it was a good discussion all around. I'm comfortable right now kind of putting a pin in it till tomorrow. Is everybody else? Okay. So what I'd like to do,
I think we should stay till now.
we can if you want. Although, I do. Yeah. So I feel like we're at a really good point. What I will plan on doing, I would like to circle back around with you, Bridget, and maybe Amanda tomorrow, because I would like to kind of take all these notes that I had and put them into areas. I think we've touched on every single goal to some extent, so I don't think we're left with like 2 being done and 2 left to do. I think it's just a matter of like refining and cleaning up everything. But if anyone had specific they wanted to elaborate, if you could maybe tonight go home and write that down and get it to Bridget.
If you can send me anything, we'll populate that template. We'll put it into the OneDrive, then everyone can view it. And then we'll have that for tomorrow, so you can all see it, and we can pull it up again. That way, everyone can see it before you go on it.
Do you think it's a reality to have it done by like noon tomorrow?
I'll have to look at our calendars. I think it depends on what time you're available.
Well, I can do first thing, so, if we can have that goal of maybe having it
think we can.
in a drive-by and out to you by noon tomorrow, give you, if you want to take a look at it, or else it's fine if you can't take a look at it till the meeting tomorrow, that's fine too, so, okay. Then at least everyone will have it to follow along with too. Anyone have any other thoughts on how they'd like to proceed? But that's what I'm.
I want to know, how was your trip to Spring?
We had some good discussions. It wasn't as hopeful as maybe I have for the trip to Denver with the national conference, so that we have coming up. So Springfield, so we'll change on the agenda to, I'm sure there's like comments, but yeah, I can, I didn't actually, President's report right there. Yeah, we went to Springfield, and we had the conference. It was. It was. It was. I think the highlight of Amanda's was the tour of the the Senate floor. So, that was good. But, I just think there's more, and I will elaborate, because the discussion brought up about going to other mental health boards. And, I really had high hopes for that's what we were doing. That we were going to go and we were going to collaborate. And I think we tried to have those discussions. It was just a little more disconnected. There's a lot more that they could do with that meeting. I think there's a lot more resource sharing, idea sharing, collaboration that could occur and I think that also the part is we're one of the biggest mental health boards. So a lot of them that are there, like, it's really different when they have like $1 million budget, to be able to share resources is kind of limited, and everyone takes a very different approach as far as what they feel like, because you have to, when you only have, $350,000 or $1 million, it has to be a very different approach. So it was good, but it wasn't great. It wasn't where I think it should be, which we all, have learning that we can, and maybe we'd better provide feedback with. Well, but we are going then to the national conference this weekend. So hopefully that will be even better. So thank you.
Thank you.
Yeah. So anyone?
Promising.
What? Hopefully, we'll hope. So that cleared, no new business, President's report, any other member comments or anything you want to add to this, or we'll have this discussion tomorrow, and then the plan moving forward is to put it into a draft form for next month then. But any ideas, please try to put together tonight or first thing tomorrow morning so we can have all this together for us tomorrow to start again. So, great. Then I will entertain a motion to adjourn. Motion, is there a second? Second. Motion is second. Any discussion? All those in favor, say aye. Aye. Any opposed? We are adjourned till tomorrow. Thank you. Thank you all for your input.